Good evening, everyone. It's a pleasure to welcome you all again. And today we are indeed thrilled to have with us Sunita ma'am once again, who has been a constant source of inspiration for all of us. And we also have with us Dr. Kiran Kotkote sir. I'm really happy to tell you that today is the 295th episode of the Gyan Pravah series that we have been doing every day of the week from 8 p.m. onwards. And even today, we are back with you guys. And today, we are going to talk on women's health frontiers, bridging innovation and impact. So, right at the beginning, I would, of course, like to introduce our President Fogsi, Dr. Sunita
Not my
Tandulwadkar, ma'am.
introduction.
No, not an introduction, but I need to tell this, ma'am. It's been a pleasure and absolutely an honor to work with you. We have learned so much from you. You have really inspired us day in and day out. And in spite of your busy schedule, you made it a point to join every podcast whenever we give you just one call, and we knew that okay, ma'am will be here. In case if you don't return the call back, also we know you're going to be there. So thank you so much, ma'am. Thank you for being here. Thank you for giving us the opportunity. So we request you to say a few words of inspiration for everyone present over here.
Thank you, Priyankar. Thank you. And it is so much pleasure that we have today Kiran with us. It's always proud moment to have your own friend from amongst president of your own society, own city to have there. And I'm sure, Priyankur, this is going to be one of the best podcasts you have ever have. Kiran, it is a one of, when we started and we decided we'll do this podcast, everyone asked me only one thing. You are asking for too much of a commitment because you have so many projects in your hand. You are traveling and mainly reaching to the unreached areas like Agartala in Tripura, Meghalaya, Shillong, Dibrugarh in Assam. It is very, very important. Do you think you will be? I said, let's do it and let's see how it goes. And 295 days, every day at 8 p.m. I joined. And I joined just to show our respect to the faculty who have come, that you are on a Fogsi podcast, Gyan Pravah, taking out your valuable time, making it one of the most cherishable podcast ever. And Priyankur, I'm sure you will send him the link so that this podcast, he can send it all Maharashtra and all India as well. So
Absolutely,
thank
ma'am.
you, Kiran. Thank you once more for coming on a Foxy platform. And thank you, Priyankur, for having Kiran with us. I think this is the history we created, Pune OBGY Society. For the first time, the Foxy president, the ICOG chairperson, and the AMOX president is all from Pune. So that is really, I don't think it will happen ever again. At least Foxy में तो ये कभी नहीं होगा. President and chairperson from the same society, at least for a decade, what I can see. You never know, history will be always repeated. But I will join the viewers link and I will enjoy the dialogue between both of you. Thank you. Thank you.
Thank you so much once again, ma'am, for being here, for again inspiring us. Thank you, ma'am. And it will be a pleasure, I'm sure, to talk to Kiran sir, who is always a figure that we look forward to. So thank you once again, ma'am, for joining us for today's session.
Thank you.
So, good evening once again, and it's a pleasure again to welcome Kiran sir with us. Kiran sir has been a chairperson of the MTP committee of Foxy. He has been the chairperson of MTP committee of AMOX previously, but currently he is the president of AMOX, and it's such a pleasure to be with sir today to interview him on this important topic. And having someone of your stature, sir, gives sometimes a little bit of not a very comfortable scenario, because I do understand that it's a busy schedule, it's a busy time, and in spite of that, you have given me time for this podcast, sir.
Thank you, Priyankur. Thank you at the outset. Thank you, Dr. Sunita Tandulwadkar, for considering me for this particular podcast. And thank you, Priyankur, because I really admire the efforts. 295 episodes and still more to go. I'm sure that you are putting your heart and soul into this, and really, we as Foxians are really proud of you. And of course, Dr. Sunita, for consistency is the phone. So this is the kind of consistency that is demanded from each and every Foxy member, that you put your heart into whatever you are doing or whatever you are delegated to. So thank you for inviting me on this time. Thank you.
Pleasure, sir. Thank you so much, sir, for joining us. So, sir, as we said, today we are going to discuss on this important topic, and this is a topic that, I feel in today's day it's quite very important because especially the youngsters are looking forward for things. They're looking forward for opportunities. We want to, look at the innovation and impact that probably we can bridge at, and we can probably bring a betterment to the women's health in general. So, sir, to start off with, I mean, like, of course, you being such a senior practitioner, we all know that, you have brought in a lot of innovation to laparoscopy. You do a lot of endoscopic surgeries, being a senior gynecologist over there in Pune, sir. So, sir, I would like to ask you first and foremost, the most important thing I would, for us of our generation was the COVID-19 pandemic. So,
Hmm.
sir, the first question that I would like to ask you is, how do you see the journey of OBGYN in India post-pandemic, especially for, we have all seen the pre-pandemic and the post-pandemic area. I'm sure there are a lot of juniors here. So how do you address them? What do you tell them that post-pandemic, how should it be?
Yes. See, Dr. Priyankur, the pandemic taught us a lot of things. Uh, what must do post-pandemic is it accelerated three durable shifts. That is, the first one is decentralization of the care, that is tele or remote, emphasis on quality and resilience in public maternity services, and faster adoption of digital or AI tools. So, post-pandemic, we are relying more and more on the webinars rather than on the physical conferences. So, the pandemic has changed a lot. Many people have started using the AI tools or the digital marketing tools in a better way and with a better efficacy. So, I think the mindset also has changed. There has been a drastic shift because nothing is permanent. The thing that is nothing is permanent has now been embedded. So people have started giving more and more time to their own uh, personal space also, as well as to the quality and academic space also. So I think pandemic has done something which we never thought of.
Absolutely. I think all of us have realized that the age-old saying of "Kal kisne dekha" is very, very true, and none of us have seen it, and we don't even know we'll live to see it or not. So I think that's why is the era, the state that we are staying in today, sir. So, right, sir. To start off with, we'll like to start off with an obstetrics question, and what better than a collaboration that happens between Foxy and Amox, which is something that we always look forward to because it gives so much of opportunities. So, sir, what according to you in recent times has been the most impactful initiative between Foxy and Amox?
Well, I fully agree. AMOX is a state body, and practically all the programs of AMOX are aligned with our central body, that is Foxy. So, whenever there is a collaboration between the national and the state body, the result is fantastic. So, training on evidence-based protocols like PPH management, management of eclampsia, and emergency obstetric care have benefited a lot. There are a few programs which I would like to highlight. One is, of course, the Dakshata model, that is the WHO Safe Childbirth checklist that has been incorporated into the Foxy and Amounts manual. The Lakshata, that is the Labor Room Quality Improvement Initiative, again a joint collaboration between the Foxy and Amounts. And of course, nationwide, the collaboration, that is the Pradhan Mantri Surakshit Matritva Abhiyan. This has impacted greatly to the maternity services, the mother and child services, which are given by all the Foxians or all Amousians to the grassroots workers, as well as to the peripheral workers wherever the facility is not available. So to the end point, right from the tertiary care center to the end point, various checklists are available. And because of these webinars, we are able to promulgate these ideas or these thought processes right to the end of the caregivers.
Absolutely. So you talked about the endpoint. I think the endpoint is which is the most important because they cater to a huge population of patients, I would say. So, sir, of course, obstetric surveillance is very, very important and it's challenging as well, especially in the endpoints. So, sir, how do you feel AI has impacted fetal monitoring, and how is it impacting the practice in general, especially of youngsters in the periphery, especially?
Yeah, through this podcast, I would like to emphasize that AI has changed everything. And the earlier you imbibe AI into your general practice, the more better thing. For example, AI has impacted each and every set in the field of OBGY, and pertaining to this question, that is fetal monitoring. So automated interpretation of cardiotopography is one of the best things that can be done by the AI. This will be this will reduce the inter-observer variability and flag early patterns of concern. For example, my interpretation of CTG might be different from your interpretation, which another intern may be different from Dr. Sunita's interpretation. So, AI is going to give us a checklist or a list which will trigger the flaws in the CTG, okay, which will help us to deliver the babies earlier, deliver healthy babies, and of course to reduce the fetal and the perinatal mortality. So most important thing is that one must remember is we have to use AI as an adjunct and not as a replacement, because clinical context again and the bedside assessment remains the forefront. But so use AI with a caution and validate any commercial or academic tool on the local population data, because the data which we get is the Caucasian data. The data which is supplied to us is a Caucasian. So more and more Indian data is necessary before we again subject ourselves to the AI-driven data.
Absolutely, sir. So I think perfectly said. And then when you said, I think the most important line from what you just said, I think would be that, it has to work hand in hand. Because some of us do not imbibe AI thinking that probably in 10 years from now, obstetricians will be obsolete and it will be AI doing everything. That is never probably possible. It has to work hand in hand so that, together we can build a better patient care, better woman care ultimately. Thank you so much, sir, for highlighting that point. Now, a little bit about, because all of us, I think, when we started our practice, when we were studying, especially of, my generation, the mid 40s, we always studied a safe mother and a safe child model. But now I think all of us have to shift it to the safe mother, safe child, and the safe doctor model as well, because it's very, very important in this medical legal world. So, sir, ethics and patient voice are equally crucial in today's day. How do you handle evolving birth plans and patient expectations? Because we see a lot of cesarean sections which say patient's request. Now, how do you handle that with the patient's expectation? How should we take it forward?
Yes. Now, again, Dr. Priyankur, with the advent of AI and with the advent of digital media, the patients have become very tech savvy. So when I started my practice or when I learned in my undergraduate or postgraduate days, I did not have any concept of discussing the birth plan with the patient. There was no such concept of discussing the birth plans. She just used to come in labor pain and we used to deliver her. Okay. But the times have changed. Now, each and every patient deserves the birth plan to be discussed in detail. And, her autonomy has to be respected. A shared decision making has to be done. For example, if a patient says that I want to go ahead and do an elective cesarean section, then that particular decision of hers has to be respected because it is her body. So, this kind of respect has to be, this kind of change in the mindset has to be there amongst us obstetricians. So, as far as communication is concerned, early empathetic communication. So, in terms of good antenatal clinics, birth planning visits, giving them a set goal of expectations will reduce the conflict that can occur at the time of labor. Number two, documentation. So, record the counselings. Alternatives, you have to record the alternatives which you are going to offer to the couple and take an informed consent. And third, systems. The systems have to be in place which will facilitate pathways for example, vaginal birth after C-section or a gentle physiological birth or even a planned cesarean section or even a planned water birthing. So all these things have to be discussed in detail with the patient and ultimately her decision has to be respected.
Absolutely agreed, sir. I think the ultimate point is that the decision of the patient is final. We can give them options. We can tell them that this is better, that is better, but ultimately we have to respect what they say. Perfect, sir. That's it, sir. Next, of course, we'll shift a little bit to the gynecological thing of, being from, we have like all of us, I think all of us have shifted from being radical to a little bit of organ preserving sort of an approach where we are not doing too many hysterectomies in today's day. Sir, Amox and Foxy both have built a capacity of hysterolaparoscopy in and especially training a lot of youngsters to the hysterolaparoscopy procedures. So, sir, what do you feel further needs to be done to empower a young gynecologist towards preventive gynecology in hysterolaparoscopy?
I understand. Now, you see, endoscopy is again now has become a super specialty in the field of obstetrics and gynecology. So, this particular training has been lacking somehow or the other in our medical colleges. So, as a matter of fact, I am very proud to say that our president, Dr. Sunita Tandulwadkar, has initiated the Project Eagle. That is, every aspiring gynecologist should learn endoscopy. So, that's a fantastic project which is taken by all our endoscopic surgeons to the periphery or to the government hospitals, wherein they are taught hands-on on various models as well as on the patients how to do a laparoscopy and histoscopy. Now, AMOX has delved into two things. One, of course, in conjunction with this with the National School of Histoscopy, which is there in Pune at Symbiosis, we have initiated histoscopy training programs, which will be beneficial not only for Amoxians but also for all the Foxians also. So that is one thing that we have triggered. Number two, we have partnered with two wet labs, wherein we are giving training in hands-on training on the wet labs as far as the retroperitoneal dissection is concerned. So, there are various other bodies, like, for example, we have our national body that is IAG, that gives training on cadaver dissection as well as on the live tissue also. So, if all these bodies combined, that is amongst Foxy, IAG, the various collaborate, they have a good collaboration, then I'm sure that the art and the science of laparoscopy and histoscopy can be taken to the budding gynecologists, and we are doing that.
Absolutely. So I think as ma'am was saying, for a first, I think we also, if we realize it this way also, another first probably is all the biggest organizations in the country currently have presidents who are situated in Maharashtra. Sunita ma'am for Foxy, Dr. Kalyan for IAG, Dr. Amit Patki for ISAR, and you, of course, the president of AMOX. So, sir, this are, I feel, the biggest organization bodies that is present currently, and that's wonderful because, Maharashtra, we as students, and, even if I ask my father, who's also a gynecologist, he says the hub of gynecology is in Maharashtra. So I think that taking forward, I think there are a lot of things that have changed, a lot of training programs that have come in, a lot of things that are helping us, and helping also the youngsters to help them to, be a budding sort of I would say more towards a preventive gynecological sort of a picture. So we also talk of menopause, which is a growing area in today's day. There are things that we tend to do. So what do you feel towards MHT? Is that something that in today's day, as a recent advancement, is something that we can do, or you feel that that is something that is a little underrated even in today's recent advances?
Yes, well, as far as the MHT is concerned, yes, because as you are rightly aware that because of the increased life expectancy, the span during which the lady will be menopausal has also increased. If at all you say that the age of menarche has gone down up to 9 years, then the age of menopause also is right now around 50, and if at all you consider the average lifespan easily as about 75. Okay, so 25 years is a pretty long time, and in these entire 25 years, the patient, the woman has all her needs pertaining to menopause have to be catered to. So individual risk assessment for MHT or alternative strategies using digital tools will ensure better outcome for all these postmenopausal women. So moving from one size fits all MHT to individualized risk benefit assessment. For example, the age related risk, the time since menopause, the cardiometabolic risk, the previous history of any oncological episodes in the family. So all these are going to give us a good guideline to cater to that particular lady in a tailored fashion rather than a shotgun therapy like one MHT will fit all.
Absolutely, sir. So since we are talking of it, I think another important thing in today's day is HPV vaccination, HPV rather. So we do talk of colposcopy, we do talk of a lot of things, but ultimately we also see that there are a lot of hysterectomies that are being done, sometimes unnecessarily. So, sir, where do you see colposcopy in today's day, and are colposcopy camps, which may be AI driven, vital in today's scenario?
Yes, very, very nice question. And I think through this podcast, there are various programs which are taken by our organization, and these are helping us to prevent unnecessary hysterectomies. And one such program is, of course, Save the Uterus. So, this is a very good initiative taken by Foxy as well as IAG. As far as the oncology and colposcopy is concerned, yes, you rightly said that colposcopy is coming up in a big way. And if at all we take the AI-driven images, it will help us to early diagnosis of of either any kind of cervical lesion or any kind of histoscopic lesion, because we also have AI in histoscopy, wherein if at all you do a office histoscopy, you can differentiate between a polyp and other lesions as far as the histoscopy are concerned. So, scaling up VI screenings nationwide and ensuring that the report becomes standard. These are the priorities. And colposcopy camps, the more amount of colposcopy camps, the more amount of VIA camps that we take, these are very essential in especially places where the awareness of cancer is very low. Again, as far as the therapeutics is concerned, PARP inhibitors, that is maintenance therapy for BRCA mutated ovarian cancers, immune checkpoints. These are all different things which are going to come up in big way in metro cities. Now, again, colposcopy, the increasing the trend of see and treat. So, see and treat is the again the new norm today. So you see a lesion and you treat the lesion immediately. So that has also become a very important tool in the hands of a gynecologist to prevent in terms of preventive oncology and avoiding unnecessary hysterectomies.
Perfect, sir. Perfect. I think because when I knew it that you would perfectly tell us about this AI being a person who has himself imbibed a lot of it. So we actually could go on and on with this topic of AI with you, especially. But then I think so. I thought it would be more pertinent to touch all the topics. You beautifully highlighted points on obstetrics, gynecology, as well as oncology to a certain extent. But now, since we have a lot of youngsters who listen to podcasts, I would like to bring a little bit of, off the topic of streamline obstetrics and gynecology. We would like to a little bit talk about the research and paper contribution. Me being a past president of VETOG, whenever we used to come out with a paper from India, people used to say, "Oh, is this data correct? Is this data right? Is this an authentic data?" So that is a picture that we definitely need to change. Again, we are sitting in an era of ChatGPT, where probably papers are written in 5 minutes, and that has got no validity and nothing. So, what do you say? What is your advice to the juniors? How should they look about doing an authentic study? Is something that we want to know from you, sir.
Well, as you rightly said, that papers definitely are going to are going to be very important. As a matter of fact, rather than copying from Chat GPT and all, I think juniors should imbibe upon about the use of AI in writing the papers. At the Star Sampurna conference, we have an entire session on how to use AI as far as your paper presentation is concerned. Because we have all of us have got a huge amount of data in our private and clinical practice, but we don't know how to put that data into perspective. So, as a matter of fact, we are having a good number of data. In this particular tenure of Dr. Sunita, she is also having a good data on know your numbers. For example, we have the Google Sheets wherein we'll fill the data, and a data of more than 1 crore women will be taken. We also had a good eclampsia registry at the time of we had a good Fogsi eclampsia registry. So, all the data of all the eclampsia cases which are happening in India were entered into that registry, and that registry is growing. Similarly, we have different registries, that is the Lakshya Manyata registry, the ICMR registry, and so on and so forth. So I think as far as all the emerging gynecologists are concerned, we have to use this data and AI tools and effectively publish as many papers as possible. As a matter of fact, my appeal to everyone will be, whenever you attend a conference not only as a delegate, but also attend a conference as a paper presenter or a poster presenter. This way, your own data or assessing or analyzing your own data, that quality will improve. And the quality by which you treat your patients, again, that will improve.
Absolutely. I mean, when we have a data on our topic, it's best to give it forward in a collaborative sort of a way, which helps. So next, of course, you being the head of the organization in AMOGS, plus of course the other organizations like Foxy, IAG, ISA that we talked about. So what do you look at a future of collaborative research between these societies, and what is your take on a proper multi-centric Indian data and that being published probably in any journal with a good impact factor?
Yes, I think collaborative study within all the society is very essential. And fortunately for us, all the heads of the organizations currently are on the same page. Because when it comes to research, when it comes to ethics, uh, we are fortunate that we have got fantastic leaders who are on the same page. And yes, multicentric society-led studies is going to benefit the organizations also, as well as the members also. So we need to have harmonized protocols, common data dictionary, for example, and obtain certain ethics approvals where possible, and create ECRFs and distribute clear SOPs for the quality. For example, SOPs in management of PPH. I think it's such a simple thing to do. All the collaborative organizations should get together and create a common SOPs so that the members are benefited. And yes, as I said in the beginning itself, Foxy and Amox is definitely going to support Foxy in all such projects which are going to generate more robust and sizable evidence.
Perfect, sir. So now we need to definitely touch a little bit about infertility. So, sir, infertility, of course, is rising in today's day. So is technology. So, sir, in your personal, purview, personal space, what do you feel IVF technology which is racing ahead, which excites you the most?
Well, as you rightly said, yes, the prevalence of infertility is rising. There are multiple reasons because of that. One, of course, is delayed marriage, lifestyle changes, poor ovarian reserves, low AMH in younger girls. So all these are rising, and the awarenesses and access have improved, but the stigma of infertility remains. So what we are doing as far as our local organization is concerned, that is, we are making people aware through a program which is called as Me Manasvi. So, all these girls are made aware of their fertility potential in form of doing a sonography, in form of doing a AMH at that early stage. And if they are delaying the marriage, then awareness about oocyte preservation. So that is a very important thing that one must do in these young girls. So creating an awareness about upon infertility. So that is very important. Again, all the most important thing is unequal access to ART centers. So that is again a very big challenge to all these couples, infertile couples. For example, we have got huge amount of ART centers in the metros, but ART centers are lagging in tier 2 and tier 3 cities. So, making ART centers available at tier 2 and tier 3 cities is equally important. And Amox has launched two very good programs, that is Anybody Can Do IVF, wherein we are, training all Amoxians and Foxians to imbibe upon the new things which are coming up in the field of infertility, oocyte, how to do quality ovarian stimulations, and we are giving them hands-on training in the labs and the IVF centers, so that their confidence to set up ART centers in tier 2 and tier 3 cities increase.
That's wonderful, sir. That's wonderful. So today, sir, we also need to talk a little bit about ART and ethics. So third-party reproduction is in current days a thing that is not understood of much. But again, third-party reproduction, there are some bit of tools. People are talking about embryoscope, etc., etc. A lot of things that are coming into place. But what is your take on the ART Act, and what things that you require for better transparency that you would like to pass on to your juniors as being the head of the Amox organization?
Yeah, so as far as the ART thing is concerned, the main challenge in ART is the availability of a good embryologist, number one. And number two, we have to depend upon the embryologist to give to grade the embryos and give us good quality embryos. Of course, I would urge people, to take upon time-lapse embryo imaging or AI-driven selections for the embryos. So, what is going to happen is the reliance on the embryologist is going to go down. So again, that is one of the most important take-home message. Of course, patient counseling, of course, is essential, as you said, in the third-party reproduction. So all the ethical and the legal guidelines have to be followed as far as the third-party reproduction is concerned. And ART Act, it mandates transparency and registry compliance. And Amox is very firm and very strict about their members complying with the authorities. so that all the ethical and the legal standards are adhered to. So, which will make this particular field of obstetric and gynecology more transparent, more ethical, and more legal and more accessible to the general population.
Absolutely. Perfectly well said, sir. So, of course, again, if we look at, we talked about technology, we talked about artificial intelligence in medicine that has really gone on and increasing. So, what do you feel about, how this AI should be imbibed by the government of India towards, figuring out or making a few health policies for the betterment of women?
Well, I think it's a crucial question because, whenever any organization, as an organization, I feel that whenever we represent to the government on any forum, we should encourage government, especially the Department of Science and Technology, the ICMR, and the Health Ministry of Health and Family Welfare to, imbibe AI in their day-to-day activities. AI is going to allow us to collect massive amount of information on real-time health data across districts, states, and facilities. And if at all it is analyzed with AI algorithms, it is going to provide precise insights into the trends of the disease, the utilization of healthcare, the outcomes, for example, the number of C-sections. The number of C-sections which are carried out in a primary health center, in a district health hospital. So if at all this data is shared by the government with the organizations, then the organizations also share their data with the government, and a collaborative setup can be made wherein the ultimately the public would be benefited.
Beneficial.
Yes.
Perfect, sir. So there are, as you said, a lot of programs by the government. There are, several pilot programs that are underway. There is talk of a digital health ID that is going to be given, etc. Do you feel these are things with the AI that are going to help in the future?
Yes, definitely yes. Because, by accurately mapping the disease burden and predicting the outcomes, the AI is going to help policymakers prioritize more pressing needs, whether deploying more maternal health workers. For example, in an area where the maternal mortality is high, the government can tie up with organizations like Fogsi or Amox and deploy us to screen those patients or to give them a quality care wherein the people are not available. For example, we are giving free maternity services on 9th of every month as told by the Prime Minister. So that's a very big thing that our people are doing. So the government is also aware of that. In the same way, if the government or any body can inform us that through AI-driven models or through their data that any kind of help is required from our bodies, then of course we are going to reach out to the government and also to reach out where the facility is required in the maximum way, so that the waste is reduced. It is going to highlight the unserved population and and we will help the government to plan for a better current and a future needs and ensure that our tax-paid rupee is used in a wiser way.
Absolutely. Ultimately, it's just that minimum fraction which pays the tax, and that definitely needs to be used in a better way for the betterment of the country and the women that we strive for. So leadership is something that we really look forward to. Like being a youngster, I mean, I have always looked up to you, Sunita ma'am, for things, and we have learned so much from you guys, sir. So what would be your message for youngsters like me, who would like to, lead and innovate in the future, or what would be your learning tips for us?
Well, I cannot call myself as a Baba or Sadhu or something, or to give you something. But at the same time, I would like to say that each one of you, each one of those who are listening, should do two or three things that come to your mind. Number one, work for the organization, because don't think what the organization is going to give you, but think what you can give the organization. If you think it this particular way, I am sure that more and more leaders will be created. Number one. Number two, as a leader, what I would say that I am not going to tell you what I can do. What I will be telling you or the youngsters is what you can do. So, to get the best out of the youngsters is one of the key factors that a leader has to incorporate. And I can definitely say that projects like Project Eagle or the ABCDI or the anybody can do aesthetic gynecology have brought out excellent, marvelous people who can lead the organization. Now, what remains from them is to give more and more time for the organization and in turn, the organization is definitely going to award you in some way or the other. So I think this is most important. Last but not the least, give time. You should not be in a hurry. Everyone is in a hurry. Yeah, I want XYZ position or a post. It's everything has got a latent phase. Everything has got a time. So allow that time, and once you allow that time, everything will be given to you at some point of the time or the other. That is what my take is.
Absolutely, sir. Agreed. Because the thing is, nothing happens in haste. It takes time. It takes time to build, and we also need to get a lot of experience. Thank you so much, sir, for that point. Now, of course, Foxy and Amox does a lot of things in collaboration. So, how do you look at the fact that Foxy and Amox, the committees, can work together for a better impact, especially helping the juniors to look forward to a way forward in their path in these organizations?
Yes, I think Foxy has got a huge, huge role to play because it's a pan-India organization with more than 36,000 people. So as far as Amox is concerned, number one, I tell from the Amox forum to everyone that the Foxy membership should increase. So I urge all my Amox societies, the president and secretaries to make members of their own organization or their own society. So automatically the strength of Amox improves. And if the strength of Amox improves, indirectly the strength of Foxy also improves. So this is the first thing is, of course, improving the strength of the organization, number one. Number two, what we have done as far as all Amox programs are concerned is, for example, if there is a program on endoscopy in Amox, then we have to take the local state chairperson as well as the national chairpersons in that particular program. So we are already doing this in all the programs. So I would urge Foxy leaders also that whenever they have any such program, you take the local chairperson of that state also. For example, if at all you are having a program on endoscopy or you are going to have a program on, say, emergency obstetrics in Maharashtra, then it is better that you take the chairperson of that particular body in that program. So he or she can contribute to the program also, as well as the ideas of Foxy also can be transported to Amoxians also. So same thing goes for something which you can do in Gujarat or Karnataka or Kerala or Andhra Pradesh or Shillong or anywhere where you go. So Amox, again, once again, I say that Amox is in line, all the thought processes of Amox are in line with all the thought processes of our central body, that is Foxy. And Amox always is going to help Foxy in whatever Foxy programs are there or Foxy guidelines are there, or even Amox is always there to reach out to Foxy and conduct teaching and training programs of Foxy. As a matter of fact, I would like to congratulate Dr. Sunita also, and we had a very beautiful meeting about a couple of days back with the incoming Foxy president, Dr. Bhaskar Pal also. And we have promised Dr. Bhaskar Pal also that whatever activities he is going to conduct or his thought processes as far as Maharashtra is concerned, these will be in line with Foxy and Amox as a collaboration together.
That's wonderful, sir. That's great. That's great news for all of us, actually. Of course, the way forward, as we were talking about bridging the gap. So we will talk a little bit about bridging the gap between the youngsters and also the youngsters like you. So how do you see handholding and passing on the baton as one of the things in today's day, like as a learning tip from you all, the seniors in the field of obs and gynae?
Yes, yes, handholding. There are few people who may require a handholding. There are few like you may not, like you, Priyankur. You don't require, you are such a pro that you may not require handholding because you are putting something for the organization. As I said earlier, there are few people who understand what you are doing and who will put something for the organization continuously as a persistent effort. There are few people who may not know the importance of organization and may require some kind of handholding. So there is a saying, Sam Dam Danda Bhed. So you use Sam and Dam. You don't use Danda or Bhed in to do this thing. So you use Sam and Dam and course new people to enter into the organization. So I think that can work and that can create a beautiful set of leaders. Because today, for example, I am there. Tomorrow, I am not going to be there. Tomorrow, there is going to be somebody else. So this thought process also has to be there in our mind that today I am there, but tomorrow somebody else has to be there. And if somebody else has to be there, that person has to be so empowered that he or she will lead the organization in the same way or in the same zeal or a better way after you have left. So, for example, in Amox, I have to ensure that if I am not there as the president of Amox, there has to be somebody else who will take over the reins of Amox at a particular point of time, and he or she will take forward Amox in a better way than me. So that is how handholding has to be done, and I am going to do it as far as my organization is concerned, and I am sure leaders in Foxy are going to do their for their respective chairpersons also.
Absolutely. So I think accepting the fact that the next person will do better than you, helping that person to do better than you is something that really helps organizations to grow. Thank you so much, sir, for that once again. So finally, we are like coming to an end of this session. Thank you for your beautiful insights, sir. Your commitment always inspires the entire fraternity, sir. So I would like to request you for a few closing words before we end this beautiful session.
Again, as said, let us work unified. Uh, I would say that we will work for us own first. So, as an organization, let us work for our own first. Let us work for Foxy. Let us work for Amox members also. So once, because wherever you board any flight, what they say is first in case of emergency, oxygen mask will drop down. So first you have to put the oxygen mask on your face, and then you have to help others. So for example, here, if the oxygen mask is dropped down, first my duty will be to help my Amoxian, help my Foxian. Focus on safety, compassion, excellence, and of course, after everything has been done, then again comes to your patient. Focus on patient empathy, patient care, and give quality care. So, this will ensure a good flow and good success in the latest.
Absolutely, sir. So thank you so much, sir, Kiran, sir, for once again joining us. Thank you for this beautiful message that you passed on. We definitely need to, focus on the safety, compassion, experience, and always keep the patient at the center. But also in today's medical legal world, do not forget that we have to remember ourselves, take all consents, do all that. And today, again, we were talking of AI. So AI has even helped us. Technology has helped us in taking video documentation, etc. Maybe that is not valid in the court of law, but at least we need to take those documentations and make sure that everything is in pen and paper, because that's something that's going to help us in probably, bridging the gap between the dissatisfaction of the patient and doctor in certain cases. So thank you so much, Kiran sir, once again. For giving your time, for joining us, and for beautifully, giving your insights on this excellent topic, sir. Thank you once again, sir.
Thank you. By just a prayer which I always tell to all my all Amoxians is, I firmly believe this is a very beautiful prayer in Marathi, and that prayer is Manasane Manasashi Manasasam Vagane. That is, one human being should behave with the other human being like a human being, and not like a animal, or not like in any other way. So the blame game should stop, because ultimately the aim of a doctor is cure. So a doctor will never harm the patient. That is the foremost thing that one must tell the community also. Doctor will never harm his or her patient. So I think this thing should go. And again, to reduce the medical legal issues, you have to behave with empathy and compassion with your own colleague. Otherwise, it is going to escalate. So thank you, Dr. Priyankur. Thank you, Dr. Sunita, for inviting me. Yeah.
Thank you so much once again, sir. And as you beautifully ended, I think the very important message of circle of life that we should never forget. Don't forget that you could be on that. It could be not your day on that day. So thank you so much once again, sir. Thank you everyone for listening to this podcast, and I hope it will help you in your day-to-day practice as well. Thank you, Kiran sir, once more. Thank you so much. Thank you, sir. Thank you.